Well, hello everyone. It's Alyssa. I'm so excited that you're tuning in today. I'm so excited to have my guest, Natalie Marshall, who is a pelvic floor physical therapist here in Westfield, Indiana. And all we talk all things pelvic floor dysfunction, and actually go into some things that we weren't even planning to talk about. We had a wonderful conversation before jumping on, and we could probably talk all day long, but. So I think you'll really enjoy the conversation. I mean, really just honest, upfront, straight conversation about things that being a woman we have to deal with and some of our experiences. So we both share our stories and that sort of stuff. And she's doing amazing work in this world. And I'm so excited that she gets to share and I get to share so that you can learn some things about yourself. And one of the special things that I'm doing with her and I'm starting to do with my guests is allowing you to an opportunity to dive deeper in the topic. So what she is doing is she agreed to give away a complimentary initial session with her. If you're in the Indianapolis area, it can still be in person. However, because of the stay-at-home orders and that sort of stuff across the nation, in the world, and if you're not in Indy, you can do a telehealth visit with her. So we're giving that away. We're going to be on Patreon, which is a new platform that I'm launching on to help support this podcast so I can do it more consistently and more often because, to be honest, it takes time and childcare for me to actually be able to interview guests, record this podcast, edit, and get it all together. If you can support in any way, I'd really appreciate it. But I love being able to share all of this information with you. It's one of the reasons why I put it together, and I want to be able to give back to you. And so this is our first giveaway. And so I will link in the show notes, but you can go to Patreon and learn more about how you can participate in the giveaway. So I won't make you wait any longer. We'll dive in. Welcome to the Wild Wisdom Podcast. I'm your host, Alyssa Finnick, and this is your space to learn more about the importance of slowing down, taking care of yourself, and the mind-body connection. And most importantly, how to reclaim your health by listening to your body's innate wisdom and reconnecting with the earth. So welcome, Natalie. I'm so glad you're here and excited to talk about your three favorite things, which I think everyone should talk about, which is pee, poop, and sex. I loved reading that on your bio. And so tell our audience a little bit about yourself and what you do right now, and then maybe your story, that how you got here.
Thanks, Alyssa. I'm happy to be on your podcast. It's really fun. So I got into physical therapy kind of just almost by chance. I started in college on a pre-med track and looking out past into the future and seeing that there was a lot of science and a lot of just repetitive schooling that did not seem to connect with who I was, because I'm more of a creative spirit. I stumbled upon physical therapy and thought, this is really great because I can still do the healthcare aspect of it. I can still educate people and connect with people and still also be able to use my creative outlet. And also, if there was one area of physical therapy that I might feel stagnant in, there's so many different arenas in physical therapy that you can kind of dive into. So I wouldn't be stuck necessarily in one particular aspect of the field, much like sometimes can happen with certain medicine. So I then went to physical therapy school and still didn't really know what I wanted to specialize in, as I'm sure most people don't when they're in that situation. And Elizabeth Noble came to speak at our physical therapy school, and she is the person who brought women's health PT to the United States.
Oh.
And yeah, so she's such a really iconic person in our women's health field. And my grandparents were coming in that same day, and I couldn't break plans with them. I hadn't seen them in so long, but I thought, I'm going to need to touch base with the only person in my class who went. And she told me all about it, and I got so excited and, wish I could have been in two places at once. And looking back, wish that I would have gone to that. But I got her books, soaked it up, and told my clinical professor, I need to get into women's health physical therapy. This is what I want. This is everything. And but it kind of goes full circle back to when I was even a senior in high school doing health occupation education, which is a vocational program for half days where we shadow different healthcare professionals. And I felt so connected when I was with a midwife and seeing a birth, and with an OBGYN. And then, so I got to actually see 3 births as a senior in high school.
That's awesome.
And, yeah. And from then on, I always had this wild passion for pregnancy and postpartum, just women in general. Mm-hmm. And so when this all happened in PT school, I was like, this is why, because before then I felt no direction really. I felt like I'm just kind of going through these motions and just kind of leading whatever my heart's telling me, but that was it for me. And so I got 4 out of my 7 clinicals were with women's health physical therapists who really helped shape me, who I was even back then and as a student. And there was one women's health physical therapist in particular that I was with who really just brought me in and helped me understand everything that she knew. And we would stay up drinking, we'd put a pot of coffee on after we'd seen our patients for the day, and we'd stay up talking till like 10, 11 o'clock in the clinic. She is just so awesome and passionate for what she did. And that helped me so much as someone who would take me under their wing like that and teach me their ways. So, after that, after school, I started into practice, and I worked for a hospital for a while, and then I worked for a private practice. And then I worked for somebody who has a clinic how I have today. And the reason why I ended up in the clinic setting that I'm in now, which I own and practice as a physical therapist at Vitalize Physical Therapy in Westfield, Indiana. And it's a very unique type of practice, because as we all evolve as people, you start to kind of develop into the type of practitioner, the type of person that you connect with, and you start to be able to treat how you feel is best for your patients and migrate toward that. So instead of using a typical insurance-based model, we are able to treat patients one-on-one. Our first visits are 75 minutes. Our follow-up visits are 60 minutes. And we just treat head to toe, and we do orthopedic, but our specialty area is pelvic physical therapy. Mm-hmm. And so we primarily, our clinic, our practice is women, about probably 90%. And then we do see men as well. A lot of times it ends up being men who their wives are like, my husband has to come in now, his partner.
That's usually how it works.
Yeah, exactly. But we treat head to toe pain, and like you mentioned before, pee, poop, and sex, and all things that revolve around women, things that most people don't end up talking about, even with their closest girlfriends. A lot of people do too, but there are a lot of people who they shy away from those topics, but not us, right, Alyssa?
Not us. No, we're going to dive into all these topics today, and I think our audience will enjoy it. So, let's start there. Why is, talking, for one, just talking about it and being open to it, but also seeking help out, and, not everybody knows where to go. So that's one of the reasons I do this podcast, is because I refer a lot to other people. And so I thought, well, what? I should start sharing this knowledge with other people and having guests on, because I want people to know there are other ways to help heal and get help. There are different trained professionals out there in different areas. And so I wanted to share that with the world. And so I'm glad you're here today so we can talk about that. But why is it important to talk about, these things that seem so taboo, which everybody does, going to the bathroom, having sex, all that stuff. Everybody does it. But it's taboo for whatever. It hasn't just become, it's been become, that way for a long time. But there's lots of things that can go wrong in the pelvic floor area. And so why is it important to talk about it and, really reach out and get help with this area?
Yeah. I say that most people, and I would estimate 99% of people or more could use, especially women, could use a good pelvic physical therapist in their lifetime, at some point in their lifetime. And the pelvis and everything that it's made of is so connected to who we are. It's as deep as the breath that we breathe. Our diaphragms are connected with our pelvic floor. And whether it's when you're a child, clear up to in your 90s, your pelvis is working for you. How are you working for it? And it's one of the best investments that I think people can do, is to have someone else objectively look at their body, help them in their body get everything to line up and work how our bodies are meant to work. Because throughout our lifespan, you can have various car accidents or injuries and traumas that lead our bodies to these holding patterns. And until someone helps you to unwind that, a lot of times your body doesn't really know what to do with that. And so it's just really, really, really important to have someone who can help you. We're in this together, it takes a village. And I've tried myself, we all get caught up in our own pride. And there have been things that I've tried. I know what to do. You don't really know what to do for yourself a lot of times until you have someone who looks at you and who can assess you and put their hands on you and treat you. It's hard to treat yourself. And so that's part of women, where we should be a community together. And that's the nature of my clinic, is just to be very warm and welcoming and have people feel comfortable to come in and talk and share about things that have happened years ago and how it's affecting their life right now. And a lot of times people come in, and I've got an extensive history that I'm looking at, because as you know, everything's all connected. And I said, oh, you left this part blank. They said, oh, well, that doesn't matter because I'm just here because I leak urine. And I'm like, well, it does matter, actually. And then we start talking about how the entire body is connected.
Yeah, no, go ahead. Talk about that. I love that subject.
Yeah. Analogy where if you lay a sheet down and you tug the sheet at one end, you see the whole line of tension down the entire sheet. So that's how our fascia system works in our body. And so, for instance, a lot of women who have pelvic pain, they also have connection with headaches, TMJ, which is pain or clicking in your jaw, headaches, neck pain or neck tension, upper tract tension. And that is all connected with the pelvic floor. In fact, that therapist who I was talking about back years ago, in 2010 or 11, when I was studying with her, she was in the because it's typically one physical therapist now versus two, but she was working on a patient's pelvic floor, that was my clinical instructor. And I said, would it be okay if I worked on her neck at the same time? Because she had both issues going on. She said, that's a great idea. And so I was releasing, in her neck, and this clinical instructor said to me, did you just feel that? And I was like, yes. And she's, at the same exact moment, the neck tension release and the pelvic floor release too. And so it is amazing how the body is connected and works.
And I love that. I love that. So, one of the things what I've noticed and why I love, having guests like you on the show and talking about the pelvic floor is, as a yoga therapist, client after client would come to see me, and a lot of times, and I'm sure you do this too, because we're kind of talking the same speak here, is, somebody comes in with a shoulder stuff, and I'm like, it's probably your pelvis. Well, I'm not a physical therapist. I don't do, any manipulation or, any work with that or the muscle. Well, I guess I work with muscles, but I'm not a physical therapist anyway. So I use yogic principles and practices. But I know the patterns and that sort of stuff. And she was like, how would it be connected? But I was the first person who connected the dots for her. And where, before it was just, a lab screening, looking at the shoulder or this or that, and an x-ray or, just trying to figure it out. And I have physicians who refer to me, which I'm sure you do as well. And just looking at the connection there. But what I saw over time is that every single one of my clients had, because I work more with the energetics in the pelvis rather than the physical, like you do. And it was the physical emotional holding patterns in the pelvis over and over. Like people come in a lot with me, it's chronic pain and trauma that I see a lot. And the same patterns, maybe different stories, but same patterns. And it was always the pelvis. And so that's led me to the looking at Tammy Lynn Kent's work with the Wild Feminine. Mm-hmm. And I love her work so much. It was just like the missing piece, and then that just like slid into the puzzle and like completed everything. And I just saw it in my clients all the time, and it made so much sense, and it really influenced my work as a yoga therapist. And so that's a lot what I like to talk about now is the whole pelvic bowl and the powerhouse there and how it's connected, not only on the physical level, but on the energetic level especially. So,
well, they are all interconnected, and that whole biological piece, and the most simple analogy that, because everyone has seen a dog tuck their tail between their legs, mm-hmm. and that's what humans do as well. Our tailbone is connected with our pelvic floor, and when you are feeling shame or guilt or fear, anxiety, stress, we do tuck and hold a lot in our pelvis. Yeah. That in turn connects with your hips, your low back, your breath. We a lot of times are chest breathers instead of breathing into our bellies, mm-hmm. for a variety of reasons. Spanx are so popular. Our bellies can't breathe with those Spanx. And the underwire bras, I've tried to get all my clients away from underwire bras because of lymphatic flow and restriction of the liver and inability to fully expand that rib cage and let that diaphragm breathe. It's super important with your pelvic floor. Yeah. And I even have a couple friends who are pediatric physical therapists, and one is a pediatric pelvic physical therapist. And she talked to me recently about the importance of kids learning how to crawl and being on hands and knees, and the importance of how that breath, the diaphragm, and the core and your pelvis, your pelvic floor all work together, even from that very young age. Mm-hmm. And so if I find that a patient knows, a lot of times, parents can't remember that far back, but if they never crawled to begin with, that is really important that they learn to crawl again.
Mm-hmm. Wow. Yeah, that's interesting. I'm dealing with that right now with my daughter, and she's pretty much crawling. She was doing downward dog the other day.
Oh my gosh.
She's sticking her butt up in the air, but she's pretty much crawling. She's upstairs now while we're on this podcast. But so to try to give her more space to crawl, because I have hardwood floors, so I don't want her like necessarily on the floor and fall and hit her head. So I've got her where the carpet is and that sort of stuff. But yeah, it's so important. I know I worked with a 4-year-old. He was the sweetest, and he didn't crawl. And I can't remember the official name for it, but he has dwarfism. I can't remember how to say it. But he just lit up my world. But he didn't crawl because of the structure of his body. And so he knows how to walk and function, no problem. But that affects him. And his mom and I talked about that, and how that affects him. So it's very important. And so that's, sometimes it is back to basics, even for adults, right? And to do that, it's so interesting how the body is. It's so amazing. And I like that you shared that the diaphragm is related to the pelvic floor, because it's important for people to know that. They don't realize it. And, I talk a lot about where you're not breathing, you're not feeling. And a lot of people, we're so rigid. And I love that you talked about the underwire bras, because my mom and I literally had this conversation yesterday while on a walk, because she hates bras. And I she'll hate me for saying this, and she probably also won't care. But I was like, well, Mom, like, you don't need underwire. Like, your boobs aren't that big enough. and you don't need, you need, support, but like there's t-shirt bras, and, it doesn't have to be just an old sports bra sort of thing, but like there can be something nice, but that doesn't cut off everything. And that's important. So we literally just had this conversation. See, these are the conversations that you have when you're open to, talking about whatever and whatever.
100%. Love it.
Yes. So, but it's important we don't think about that. And I know when I was pregnant, and then, you're gaining weight, your boobs are growing, that sort of stuff. And I'm like, I have to change bras, because I could feel it cutting in, and I'm like, I don't like this feeling at all. And now even more, I'm like, give me, I like them to look nice too, but give me something that is not going to feel and anything like that. And then so it's important. So
and I experienced that during pregnancy as well. I didn't know how many times your boobs change and shift. Right. They get bigger, and then they get really big, and then they kind of go back. And
I know. It's very interesting. The pregnancy is very interesting. And so for everyone out there, Natalie and I's daughters are a month apart, maybe 3 to 4 months apart. And her daughter's just a little bit older than my Josephine. And what's your daughter's name again?
Gianna.
And I love that. What's her middle name?
Everly. Oh. So her initials spelled Gem. Gianna. Yeah.
I love it. All right. So let's talk a little bit about pregnancy and how that affects the pelvic floor, especially because that's so much on our mind right now as new mothers. And I know I have a friend who is a physician. She works mostly with Chinese medicine. And I remember having her on the podcast, and she said, it's so important to talk to women who have been pregnant, because that's often when a lot of dysfunctions begin to happen. Not that there wasn't a correlation from before or whatnot, but there's lots of things that change. And I know for me, my experience, and I'll share my story a little bit, but at 36 weeks, my hips went out, and I was on crutches. I couldn't walk. And so I've always had, this is one of the reasons also I've led to learn more about the pelvic floor area, and I'm sure there's tons more I can learn, is because I'm hypermobile. Like, I love Pilates reformer for keeping everything together. And then I love yoga, but my life, like in my lifetime, I've went to more Iyengar yoga because of the structure and the alignment and the more of the strengthening, because I'm too hypermobile in certain places, which leads to pain for me. And so anyway, but at 36 weeks, my hips went out, and I know it was also because of how I'm trained. It was fear. It was fear of moving forward because I'm a single mother. And so it was like, okay, logically, I know I can handle anything, and I have. But my body's like, yeah, but you still have feelings. And so the podcast I did with Danielle Cornelius, Dr. Danielle Cornelius, was the last one I did because I was on crutches, and then I was just in a more pain than I ever had been in my life. And I had to go to the chiropractor, and I didn't think about coming to you, but I actually, it was pregnancy or prenatal craniosacral that helped me the most, because it helped release, it helped deal with the vagus nerve and, just calm me down and let things like shift. But it wasn't really, and yes, it was the positioning of where she was in my belly, but or uterus technically, because at 40 weeks, I started walking just like a waddling pregnant woman. I wasn't on crutches anymore. And once she was born, I was fine, and could walk easily again, and just had to do some different things slowly to get back to so-called normal. But it was interesting to see those parallels of the physical body, the emotional body, that sort of thing going on within myself. But things have shifted. And definitely, that whole, people joke about, you pee a little when you sneeze, like that happened. and it was like, oh, so this is what people, this is what happened. So that was a new thing, being pregnant and that sort of stuff. So I don't know if you notice things shift for you, but I know that you work a lot with all of that in your practice. And I know that some people are also resistant to getting more, the pelvic floor physical therapy, even if it's recommended after pregnancy. What do you think kind of the scope of, why is it important, especially for women, either during pregnancy or postpartum, to pay attention to the pelvic area?
Yeah, even prior to pregnancy, if people are planning ahead that far, which most aren't, but there's so many different things that we can find and help relieve and help get on the right track before pregnancy. So I really do recommend people throughout their entire pregnancy adding physical therapy to their arsenal, to come in if there's absolutely nothing wrong, which is so rare. I've never seen it. Mm-hmm. There are always things that we can work on. And so most of our patients who are pregnant will come in every 2 to 4 weeks, because your body is changing throughout the entire pregnancy. And so to keep up on everything and help keep your body and your mind in the most optimal position is so key. So, various things can happen. So in the first trimester, I think that's mostly, for most people, it's just survival. And you're so sleep deprived. So sleep more, especially if it's your first. Sleep as much as you can. Mm-hmm. A lot of people are nauseous. I was nauseous well into my second trimester. I didn't ever have that blissful period. I was very nauseous. But in that first trimester, your body is just kind of adjusting. Once people start to get to the end of their first trimester, though, we can really start to work on the body and helping to prepare it for pregnancy even that early on. Because if you think about it throughout your lifespan, how many sports have you played? How many horses have you ridden, or bikes have you fell off of, or car accidents, or there are so many things that our bodies take, and especially as kids, cellular renewal is amazing, but your body still has all these holding patterns, and they start to, for some reason, come up during pregnancy the most. And so you could have restrictions in your hips, your pelvic floor, your abdomen. It's also connected, and your body has to stretch and grow and expand to hold that baby. By the end of pregnancy, the pelvic floor on average holds about an extra 12 pounds of weight. And so I always use this analogy too. If you extend your arm out in front of you and pretend you're holding a bowling ball on your hand, like a 12-pound bowling ball, your arm would get really tired. And it's boot camp for your body and your pelvic floor. That's a lot of extra tension and weight. And what most people don't know, I think the statistic is maybe 5% of women realize that your pelvic floor muscles are the muscles that the baby is pushed with, and the muscles have to expand for the baby to come through. And so look at the big athletes out there. If any baby had to push through a quad muscle, they get a lot of rehab, you know, especially if they knew it was coming. They get rehab before and they get rehab after that.
That is true.
Right. So those muscles are tired, and then they have to strain and stretch to push that baby out. And I also have to add in C-sections. You know, a lot of people either elect for that, or it happens, or it can even be a traumatic experience. And they think, oh, well, my pelvic floor wasn't affected because I had a C-section. Unfortunately, that's not true. And your pelvic floor for your entire term, your entire pregnancy, held that baby. And because of the cuts that were made and the surgery, the major surgery that happened, your fascia at that area, at that level, is all connected with your pelvic floor as well. So you can still have pain with intercourse. You can still have urinary incontinence or urinary frequency. You can still have constipation or all the other things that can come postpartum as well. So whether or not you had a vaginal delivery or a C-section, it's all really, really affected. And so if you stay on top of things on the front end, it's much easier to help or fix on the back end. And it's not that, I want to also mention, if somebody has never heard of physical therapy and they have 10 kids and they have all these issues, there is still hope, and most people can get close to 100% back to their normal life and bodies, because the body has this innate ability to heal itself if we set those conditions right. So anyway, pregnancy's huge, postpartum's huge. There's a lot of things that can happen, and the bowl of muscles is holding up your bladder in the front, the uterus, fallopian tubes, ovaries, and the rectum. And so that's the whole pee, poop, and sex connection, and how they're all correlated. Everything is super low, sits in that bowl. And so what we find is it's not just the pelvic floor muscles, it's the organs that sit up in that, or down in that pelvis as well. And so we do visceral manipulation. And so if we find that the bladder is stuck, a lot of times that's connected with various muscles. Same with the uterus, the ovaries, and the rectum. There's so much that we can find and release that interconnects with the pelvic floor. And so at first glance, it might look like, oh, this is just a pelvic floor dysfunction, but it's much more than that. And your body during pregnancy does have to stretch and grow and expand to hold the baby. Well, your organs have to push to the sides too to allow for that baby to grow. And a lot of times we find, for instance, small intestine can be stuck on the front side of the spine. And with that, the mesenteric root of the small intestine can be stuck and also connected with bladder and uterus as well. And that's huge, because not only can that lead to abdominal separation, or the abdominals not coming back together with ab work. A lot of people just tend to just overwork their abs and go hard trying to get their abdominals back. But if their organs and muscles aren't ready to do that, then it can do more harm than good. And so I like to tell every woman that please don't be hard on yourself during pregnancy and postpartum. That's not the time to work out as hard as you can. That's the time to give your body grace and let your body do its natural thing, and then have a little bit of help and assistance to get you on the right track instead of just jumping right back in. You can actually do sometimes more harm than good.
Yeah, I think that's important. I'm glad that you share that with your patients, because that's important to know. Because we're in, and we, especially as women, we get bombarded with, we're supposed to look this way, and especially with social media. And it's like, no, you know what? You don't have to. And it's just going to be what it is. And yeah, you can get assistance, but it's amazing how the body can heal if you give it time and some nourishment and some guidance, and not jump back into everything. And so, was there anything that, how did you recover? Did you do a lot of things that about, or did you seek out some care as well?
Yeah. So during my pregnancy, I saw the other physical therapist in my practice. I saw her during my pregnancy every 2 weeks. Mm-hmm. And I actually had really bad tailbone pain during my pregnancy. And I'm your typical healthcare provider that should have gotten treated a long time ago, but didn't. Waited till pregnancy. And I had fallen a lot on my tailbone being in gymnastics and cheerleading and various falls, just falling off bikes and things. And I remember hurting my tailbone a variety of times. Well, it never came back. That pain I never felt until pregnancy. Well, we have all sorts of ligamentous laxity that happens and less support. And so Laura really helped me with addressing that during my pregnancy. So that was released through my pelvic floor. She was able to reach all of my trigger points vaginally. So you assess the pelvic floor muscles externally on the vulva, from the vulva, the external, what a lot of people say that's your vagina. Well, what you can see externally, is the vulva. So you can reach that first layer of pelvic floor muscle that way. And then your second and third layers you reach with one finger internally. And so the muscles, there's a variety of muscles on either side that mirror each other. It's a bowl. And she was able to reach my pubococcygeus muscle, which is further back in the pelvic floor. And it has a lot of correlation with the tailbone. And that one, especially on my right side, which is funny that I still remember all this, that one was specifically really tight and tense. So working through that, working on a variety of things during pregnancy was really helpful. So the way that I got into a more holistic realm of physical therapy was because of my own fertility experience. We had infertility that we went through for about 4 years, and I have a unicornuate uterus, so half of a uterus, and a fallopian tube that was a tube to nowhere, so a tube that was not open, and then one ovary. And so going through kind of that journey, I knew that it was very likely that my baby would not have room to flip. And so she was in fact breech. Mm-hmm. And so I did all the holistic things I could to try to flip her so I could have a vaginal birth, but that's not the position she wanted to be in. So I did have a C-section.
Oh, so did I. I get it.
Yeah. Yeah. And, as naturally minded people, that being out of our control, it's a little hard, but sure. I did everything I could to make it as natural as possible with a clear drape and a big mirror and skin on skin in the OR and all sorts of things. But, the C-section scar holds a lot of emotion. Mm-hmm. We have a lot of superficial restrictions as well as deep restrictions with those scars. And So I've also been having a lot of work on not only my scar, but all the tissue around it that's affected. And I think that's really important as well.
Well, that's good. I'm glad you shared that, because I was going to ask whether you did internal work or only external work in the vaginal area. And that's because I know, well, especially because I refer out to people, and we're both in Indianapolis, that I can share, to come to your clinic and where they can find that work. And it's important for, people to know whether they've had vaginal deliveries or C-sections and have the scars, that it's, something you can work with, and that there are people like you or the other physical therapists you have in clinic who can work in this area. And in fact, as we talk, I love interviewing guests because then I'm like, oh, well, maybe I need to get that done. I go to Mayan abdominal massage quite a lot, and did a postpartum experience or whatever. And that was really helpful for me because I found myself, I didn't know what to do. I've never had surgery, like didn't know what to do with the scar. And like kind of being okay to touch the scar, not that I hadn't touched it, but like I don't want to mess it up or do anything, and knowing what to do. And the length, actually I was told, I have no idea because I don't know any different, but I was told by like the nurses in the clinic and some other friends, they were like, you healed really fast. Like you seem like you're okay. And I'm like, I don't know any different, but it has to be because of the yoga I do and the cranial sacral, which was also a lot of myofascial work during pregnancy, and the regular body work I get, because I don't know, I don't know the difference. I don't know what it takes someone else to heal, but I know there's different varying things. And you're right that, because I had a few, it was interesting how, and I'm sure you did too, like had quite a few people I knew, having babies about the same time. And, and, some of them had, like elective pre-planned C-sections, one because she had had some issues with a birth before, so she needed to. And then somebody else had, more of the like emergency C-section because of what was going on. And, and I think someone else just had, vaginal birth, which my doctor was keen on saying spontaneous birth instead of natural, like spontaneous versus, C-section or cesarean, because he's like, they're all natural. And my doctor specifically, I really loved him because, and I found him so that I could have some, say, of course, and he was highly recommended, and he, still obviously an MD, so think, and had been an OBGYN for, he said he delivered babies in the 80s at Wishard. So for a long, long time, and delivered like over 5,000 babies, and but was open to my plan, which in the end he goes, well, we totally like blew your natural birth plan out of the water. And I was like, I was okay with it. I'm okay with it because you would always inform me. My doctor would always inform everything, because my blood pressure was getting high, and it probably was related to stress, and he thinks maybe I just might have it a little bit on the high side. It wasn't just pregnancy, but I don't know. And so he would monitor me. We were talking about an elective C-section, and I, of course, really didn't want that, but it wasn't the end of the world. I just wanted my baby to be here safe. And so what he did was he monitored me every few days, and I actually went 10 or 11 days past my due date. I think I was 9 days past my due date. Yeah, no, it was 9 days past my due date. And he let me go because he would just monitor me. But then in the hospital, like, I went to 7 centimeters on my own, but I was like, I think I want an epidural. And I remember going to baby yoga and tummy time with this lady who's like, I totally did this meditation plan and whatever. And I'm like, yeah, I didn't do that. And it is just your, and I, like you said, like a very holistic and natural minded people, like we try and, but things happen. And I remember like I didn't move much more past that. And what he said to me, he recommended like 5 a.m. He goes, I think we need to do a C-section before you start pushing. Cause I don't want, to do any risk for the baby. And I didn't either. And he said, we've talked about all this before. And I'm like, okay, let's do it. And we did. And I had talked to him about doing the more natural C-section sort of thing that, he held the baby up above the screen like afterward, and then my mom was there and because I was freezing and so it was very, I guess traumatic's the word, but it was just sort of like, I'm freezing. It wasn't a horrible experience. It was just a cold. But I remember him coming in and saying, we blew that birth plan out of the water. I'm sorry. And I said, no, I feel good about it. We made the decisions. You let me make the decisions, which was very important, is that the doctor let me make the decisions, but with obviously recommendations. And I, very thankful for that. And, a lovely, healthy baby. So every woman has a different experience, and because there's a lot of pressure to have that natural birth, and which is great, but sometimes it doesn't happen. And I know another friend of mine who I've been friends with for over 25 years, she wanted a natural birth and it was not what she wanted. And she told me, and had she not told me, things could have been different, but she had shared with me that she was, it was more probably being upset about not having the way she wanted that bothered her, and had she more been okay with it and went with the flow, then maybe it would have been a different outcome. But one thing I wanted to share with you, since we're talking about the pelvic floor, was my doctor thought that my pelvis wasn't going to be wide enough. That's why the baby wouldn't drop down enough. Like she kept coming back up. And my hairstylist and I joked about, well, not joked. She was like, well, maybe it was for the best, because as the dysfunction I can have in my pelvis area, if I don't keep it strong, is I could have been, like limping or using a cane afterwards because of how overstretched it could have gotten. So it all happens how it's supposed to. That's what I believe.
Mm-hmm.
So yeah, I'm sure there's some work that can be done in that area. But
always.
Yeah.
But I am glad that you said that too. I think that's really important during pregnancy, because oftentimes when you go to an OBGYN, it's sometimes rare to have even the C-section topic brought up at all. And so I always recommend have your C-section plan in your mind. And of course, have a plan for your vaginal birth as well. And I'm quoting plan, have just a rough idea of what you want to happen. But have a backup, and then another backup, a plan B and a plan C. And this is what I'd like to do if it goes to a C-section, so that like you feel totally comfortable with how yours ended up. A lot of people don't. And years and years of emotional distress about how a birth happened. And so going forward, because I just have worked with so many women in that same boat, I really do my best to not to induce any sort of fear, but just from a realistic perspective, I say it could be this way or it could be this way. plan for both so that you just are aware.
I love that advice because, it had my doctor not, so he literally sat down and talked to me for 45 minutes and gave me things like these articles from, because he has like a 15% C-section rate, and the national average is what, 33% or something. And he spoke to me for at least 45 minutes explaining how he wasn't, like open to them in the beginning years of his practice, and the reason why he changed his mindset about them when one of his first patients came in and that's what she wanted to do, and he had to kind of research and understand more, and so he wanted to tell me, all of the different things, and sent me home with articles to read and everything. And I am grateful for that, because it kind of blows my mind when you said that doctors don't always talk to women about that, because that's happening so much. Wow. I'm so grateful for him. And he is one of a kind, because he stayed with me the whole time. My mom was like, it's kind of weird that he's just hanging out. I mean, he went, of course, to the doctor's chambers to sleep and all that stuff. But he was just, hanging out, and the nurses like didn't know what to do with him, because the one hospital I went to, they kind of recruited him because they wanted to do more naturally minded things, but he was usually at another hospital, and I decided to go to this hospital. And so the nurses were all like, he just didn't operate like all the other physicians. And so, but I like that about him. He was kind of old and eccentric, but he was just chill, and and I'm thankful for that. So I think it's important, I guess, for everyone listening to, that you have a choice and you can make decisions, and choosing your physician who will also listen to you as well. Like, you have to be respectful of their expertise and their experience, but just to be able to listen to you, and I'm glad you're also sharing, because to have that plan B, because I think people do get attached, and I wasn't attached, and that is probably because my friend told me not to be. That was great advice from my friend, because she said, don't be attached. I think she knows it was her attachment that really caused more of the upset in her birth story than really what happened. It was probably a little bit of both, and had she not told me that, it might have been, like I said, a different story. So it's really good. It's really good for, this is why I love having this podcast. I mean, we wouldn't even plan on talking about this. But is to talk about this stuff, because it's not always openly talked about. And people need to know that women go through a lot of major experiences, whether it's birth or something else, or dealing with something just functioning in the pelvis or pelvic floor, or a cyst on an ovary, those sort of things, or not going to the bathroom, right? Something, anything. And you don't know what to do, and there are actually options out there and places to go, people like you to come see, and there are ways to start healing, and not have to live in shame, or because people don't talk about it. So it's time to talk about it, and find some relief, and that kind of stuff. Is there anything you want to share, any resources? Because I always link stuff to my show notes, and I'll link to your clinic as well. We're going to, and I'll share this a little more in the show notes, and is we're offering a little giveaway to our audience. It's a free initial evaluation via telehealth evaluation, because we're all stay-at-home orders right now. So
people are in the Indianapolis area and want to wait, we can do it in clinic too.
Okay, great. So we'll share that option as well. And And then so we're doing that giveaway on Patreon, and we'll share that information out, and there'll be a link in the show notes for that. So that's exciting. Thank you for sharing that. But is there anything, any resources, any recommendations, anything you want to share on, if people are having some type of dysfunction, even if it's not in the pelvic floor, just in the body in general, what they need to know or do, or where they can, besides going to your clinic, like how can they find out more information, or is there something they can do?
Yeah, that's a good question. I really do strongly believe that every woman is so unique and has such a unique set of circumstances that it's really hard for me to give general advice. Sure. And even my brother-in-law, who is into the CrossFit world and communities, and Natalie, you could be putting out advice all over the world, all over the place, and it's really hard for me to give generalized advice because I tend to overanalyze and think, well, if a certain particular person took this advice, that could be wrong for them, which, I don't typically recommend people to do Kegels because the majority of people have too tight of a pelvic floor. And that's often the advice given. If you're leaking urine or feces for that matter, just go ahead and do some Kegels. What do you expect? You just had a baby. That's normal. Just put a pad in. That's so false. There's so much you can do with the right help. And even with just one session with a specialized physical therapist, it really, I feel like, would benefit most of the women in the whole world. And, I'm just really passionate for that. And so if you're not in the Indianapolis area, there are a variety of great pelvic practitioners across the world. And Herman and Wallace has a provider directory on their website, and we can link that, as well as the American Physical Therapy Association through the Women's Health APTA. Okay. They also have a provider directory, and not every pelvic physical therapist has extensive experience and a lot of coursework. And so I just recommend everyone, just like you would with any doctor, do your research. And if you have an appointment or two and feel like you're really not connecting, or you might need something different, get another set of eyes on it. That's not uncommon.
Sure.
And so I think it's really important that you find someone that you connect with, because this is such intimate work. Mm-hmm. And I'm not going to connect with everybody, or not everyone will connect with me. And that's completely fine. I want every woman to find someone that they will connect with and that they feel really comfortable and open to share their story and to get the help that they deserve. So hopefully everyone can, at some point, find somebody to connect with and help them.
Well, definitely. We'll link to those provider lists or directories that you mentioned, and of course to your website. And I think it is important, and I'm glad you're sharing that. And I'm glad you're sharing the work with the world, because it's so important that, and women, they don't know. Women were taught to be ashamed of this area of their body, especially. And it's not a place, it's a place where shame is often held, but it's not a place to be ashamed of, and men too. And so I won't tell you a story that just came up. We'll go into that. We'll wrap up. But I know we could probably talk forever. Well, I probably need to come in and see you after all the, after some things settle down. It's not really worried about contact for me. It's more of just things settling down for me. But I appreciate you being on, Natalie, and sharing this and all of this information. And so it's really helpful.
Yeah, thank you for having me.
So I want to hear from you. What did you think of today's topic? Direct message me on Instagram or Facebook, or better yet, join the Wild Wisdom Collective, my free Facebook group, and chime in on the discussion. I look forward to hearing your thoughts and insight. And if you love what you're hearing, please take a moment to click the button on your smartphone to subscribe. Or, better yet, write a review and tell me why you love tuning in. And maybe you'll be featured in our listener spotlight on a future episode. I cannot wait to see you again, same time, same place next week. Wild blessings.